There's a lot that we don't know about how to treat mental illness, but there's also a lot that we do know that we don't do with regard to treating people with mental illness and assisting their families. So I think that we need to work on both levels. One is we need to do more to try to understand what's the nature and causes of mental illness, but also to figure out what kind of treatments work most effectively. But finally, there's a third piece, which is how to better implement those treatments that can make a difference in the lives of patients and their families.
The biggest areas of concern and priorities should be improved access and equity for care, finding new treatments so that we can deliver high-quality care, focus on children and youth and early intervention for our patients.
Most mental disorders begin, that is, they can be diagnosed before the age of 25. And our young people are in one of two institutions. They're either in schools or they're in jails. Linking the school to the healthcare system, we can early identify young people who are at high risk for mental disorder. We can triage them, we can intervene both on-site and off-site, and we can support them.
There's still a great deal of stigma, ignorance that goes on in our society, and a great deal of it that actually continues within the health professions as well, amongst doctors, nurses, and other health professionals that do impede the ability of patients to get the care they need, and also make it very difficult sometimes for people to come forward and to acknowledge that they have a problem.
It's not just stigma in terms of society and the individual, but it's his self-stigma also, which clients very often have towards themselves and their illness.
I think that the reality is that this matter is too important to be left to any one group of individuals, be they universities or governments or health professionals or the public at large. And so the reality is networks do need to exist, and the advantage of networks is pooling talent, sharing knowledge, and leveraging strength through numbers.
If a network has clear focus and it's going to bring together a range of practitioners and it's going to integrate from bench to bedside to community, then yes, it can make a fundamental difference going forward.
We absolutely need groups like the Graham Beck Foundation that have shown so much leadership, working in partnership with CIHR, whom I represent, and then getting the provincial health and research communities together.
An organisation like the Graham Beck Foundation is absolutely essential. This is the third year that I've participated in this conference. You know, it's not an understatement to say this would not be occurring, these discussions would not be occurring without the leadership of the Graham Beck Foundation.
Collectively we can do this, and it's even more powerful when the call comes from the community, as it would if it came from the Graham Beck Foundation.